next we're going to do a male catheter. Again, this is not best practice. This is just to show you guys how to use ANSONS Arm at home. So the first thing you're going to do, of course, is to check your doctor's orders to make sure that we can actually do this procedure. The next thing that you want to do is to grab all your supplies. For myself, I like to check the catheter itself to make sure I have the right amount of saline to inflate the balloon for the catheter. Once you have all your materials ready, you're going to set your sterile tray up, and you're going to put the pad down at your patient. From there, once you have your dressing supplies ready, I like to add the first syringe to the end of the catheter, and you're going to bring your entire tray over to the patient. From there, what I like to do, if they need a CNS, for example, or a UA, I like to put that right under the patient as well, so I can just catch it automatically, and I don't need to worry about having everything kind of ready at the last second there. Preparation is always key. So from there, again, this is not sterile technique, so bear with me. We're just going to clean on the outside. And you're just going to clean around. And with ANSONS Arm, do not use iodine. If anything, just use some water to learn how to clean. And then once you have it all kind of cleaned up there, what we're going to do is we're going to get our catheter ready. And then we're just going to lubricate the end of the catheter here. But for ANSONS Arm, you actually don't need to lubricate, but if you want to practice, you of course can. Just make sure that it's non-organic, so if it's water-based, then you're good to go. Then from there, you're just going to grab the penis, and you're just going to insert the catheter. And then from here, you should have some urine flowing, so just putting that into your cup there if you're going to get the UA. And then from there, what you're going to do is to keep advancing once you have urine. And then once you think you're far enough, what you're going to do is you're going to take your syringe and you're going to blow out the balloon, and you're just going to watch for the patient's reaction, just in case if they have any pain, then you know that you're not far enough. So we're going to insert the sterile water or the saline into the catheter. You're then going to make sure that the catheter is in place. So you're just going to give a quick tug just to make sure that it's in place, which it is. From there, you can just attach it to the Foley bag there, and then you can put the secure tape there as well onto the patient's leg, just to make sure it's even more secure. And then from there, just send your UA to lab, or if you do it yourself, then of course just do that. And yeah, just document the procedure, and they tolerated it well, and how many mils of saline that you did to inflate the balloon. And just don't forget to date and time it. I just like to do it on the secure holder there, just on the patient's leg.